Hello guys, my name is Nikolai Yusupov. In this video actually would like to show you how to perform dose rate calculator. So initially what I have running here is, you notice is I'm in the primary mode, and then when I click channel A, what you actually see right running on this pump is a primary rate mode, and it's infusing at 28.1 mLs an hour. Volume remaining is 194.8 mLs. Then you have primary time, right, 6 hours 56 minutes, and then volume infused 5.3 ml. So let's pretend, right, this is how you set up your infusion for vasoactive medications, right? Let's pretend this is your norepinephrine infusing. And where did you come up with this 28.1 ml number? Right here, actually in my hand I'm holding a drip sheet. This is a hospital drip sheet for norepinephrine medication, and we see, right, norepinephrine comes at 8 milligrams in a 250 D5W bag. Right, and here we're infusing at 28.1 mLs an hour, which comes out to be 15 mics per minute. Now, if all you do is you just copy the hospital pump setting and you set your pump for the primary rate at 28.1 mLs an hour, and you take this patient, right, and yeah, I will tell you, you have no arguments from me, right? 28.1 mLs an hour, you're definitely going to give the patient 15 mics a minute. But let's say during transport your patient decompensates and your mean arterial pressure drops, and the sending physician told you to keep the mean arterial pressure at 65 millimeters mercury and told you to titrate at 1 mic, right, every 5 minutes, right, if you need to increase the dose. So let's say now that my blood pressure is going down, I want to go from 15 mics a minute to 16 mics a minute, and here this drip sheet already tells me the rate is 30 mLs an hour. But how would you make this calculation, right, on your pump right here? If you're in standard infusion mode, you wouldn't be able to do it, because you would know that to infuse at 16 mics, that equates to 30 mLs an hour. That's why I tell you this mode should never be used for vasoactive medications or pressor medication infusion. This should be only used for regular medications like normal saline or maybe antibiotics, right? So now I want to show you, what are you going to do if you come to the hospital, and on the hospital pump, right, you check with the nurse. She tells you, okay, this guy is getting norepinephrine, the concentration is 8 milligrams in a 250 bag, he's getting 15 mics a minute. This is I definitely going to copy, and he's getting it at 28.1 mLs an hour. So what are you going to do? So we're going to set up a drug, we're going to set up a dose rate calculator, and the way you're going to do this, you're going to select your channel B. Right, so I'm now in my channel B, and then what you're going to go is you're going to click here, this button says more options. So just to go back, channel B, and when you select channel B, you're going to click more options. Once I click more options, right, you see at the bottom there's something that appears calc on. I'm going to click this on. So the moment I turn this on, you're now going into the dose rate calculator mode, and here you see, right, it gives you weight adjustments, concentrations, doses, rates, and so forth. We're going to set this up right now per the drip sheet for norepinephrine, and this is the mode you want to be when you're doing any vasoactive medications. Just to show you how did I get to this mode, right? So I'm just going to select channel C in case I needed to put up a secondary drip. So channel C, and then once you in a primary rate, you just click more options at the top, and then you click calc on, and calc on will go into this mode. So we're going to go back to channel B, and we're going to set this drug up for infusion of the norepinephrine medication. So here I'm holding my drip sheet, right? So we got to set the concentration exactly as the hospital IV pump and their bag is infusing. So we said it's norepinephrine, and this is a not weight-based drug, because we do not see, right, for a dose it's 15 mics a minute, there's no kilograms. So we're going to skip, and the way you're going to skip, you're just going to click select, and then we essentially skip the weight portion, because this is not a weight-based dose here. And then we said the concentration was 8 milligrams in a 250 bag. So this is how we're going to adjust. You could click arrow up, and then what I do is I click the fast arrow to get to 8. So 5, 7.5, and overshot, right? So you click down until you get to 8. So it's 8 milligrams, right? We double check our units, and that's in fact is correct. This will be printed on the drug label, right, on the actual bag, and then it's in the 250 bag D5W. So I'm just going to go fast again until I hit 250. Right, hit 250. The next thing I gotta do is make sure that the dose I'm going to infuse is in correct units. So here it's correct mics, right, but we're not doing per kilogram. So we're going to keep the mics, but the per kilogram we're going to eliminate. right? And then we double check, is it per minute? It's per minute. Once we confirm that, you see how the other options for the weight disappears, right? So now we are infusing this drug, right, at mics a minute, exactly as you know, the dose here. So we said we got to go at 15 mics a minute, and the moment I'm going to put the mics per minute, the pump will automatically calculate this rate mLs per hour. So let me double check here. We said we're putting in 15, so you see, right, 15 mics, and you see the moment I confirm that it's 15 mics, right, per minute, it automatically calculated the rate at 28.1 mLs an hour, right, confirmed with our sheet, right, 28.1 mLs an hour. I did not have to do any math, right, it already did that for me. The next thing here, it tells you volume remaining and volume infused, right, and then this is dose infused, how much drug you gave, right, during transport. So I'm going to show you a method that I employ. I use a 60cc syringe, right, this is a Monoject brand right here. It's a 60 ml syringe. I'm going to show you my method, how I essentially pull up this medicine using an 18 gauge needle. So make sure you use the biggest needle you got. If you try to pull this medicine up with a 24 gauge, you will have a hard time doing so. You need an alcohol swab, right, in order to cleanse the port from the medicine. And you're also going to need a half set because the syringes can only be flushed and employed with a half set. So what's the difference between a full set and a half set? I'll show you. So here I'm holding 2 administration sets. The first one, you notice, right, it has a drip chamber over here, right? So this is a full set. And the other very important factor, let's see if it will focus. For me to flush this full set, I need 20 mLs of my drug, right, to do so. So you see 20 mLs. So this is a full set. We're not going to employ this for the syringe. We employ this if we get a fresh bag, right? And here, you notice this is a half set. How do I know half set? There's no right drip chamber. And the other important factor, right, let me see if it will focus, right, for me to flush this entire set, I need 6 mLs of my drug. So if I have a 60cc syringe, I'm going to pull up 60 mLs of my medication into the syringe, and then I'm going to need 6 ml, right, to flush it. So you essentially left, you know, with like 54 mLs, to be honest. But I'll probably put at 50 mLs, right? I'm thinking that probably I'll discard the 10 ml with my flush. So you drop 60 ml, you use 6 to flush, and I would set the volume remaining over here, right? Channel B, I would put it at 50. So channel B, right, we're gonna say the volume remaining, because I'm using a syringe, I'm gonna put this at 50. And you're gonna say, well, what is the importance of the 50? The importance of that is that when the drug is gonna finish, right, it will not entrain air right into the patient. So volume infused is nothing, we gave nothing, and dose infused is nothing. So this would be the setup for the levofed for a syringe 60 ml administration. Now, before any of you guys tell me, right, this pump is not made to infuse syringes, I'm going to show you, right, directly from the manufacturer's guidelines that makes this pump, the Medsystem III, Alaris Medsystem III. Right, I'm going to open the manual, right, and here in the manual, right, this page 18 of the manual, we see for this particular pump, right, let me see if I can zoom in. Yeah, so it says here, a syringe can be used as the container for the IV fluids to be infused. Syringe sizes 20 to 60 cc such as BD and Monoject brands can be used, and I in fact have, right, a Monoject syringe right here, and that's what we're going to employ. So definitely it's approved, right, for medication administration, so we can use it, and I'll show you how to do that. What else we need to do is we're going to make a label, and we're going to copy exactly the concentration that the hospital you know, no-epi has. So I'll show you how we're going to prepare it. So we're going to take our half set, right, we already preset the pump, and I urge you to do this, right, when you are setting up your drips. So a pump is already preset. I verified my 6 rights, drug dose documentation, patient route and time. I verified this with the nurse, I verified with the pump, so there's no ambiguity, right, there's no confusion. Once we set this up, right, I'm going to come to the hospital pump, and let's pretend this is the hospital no-epi that's hanging here, right? So I have this label, I verify, right, this is no-epi, 8 milligrams in 250 D5W, it's running on the pump, and right now we're going to pretend this medicine is actually infusing into the patient. I do not want to disconnect my patient off the pump. So the syringe method allows you to acquire your medicine, right? Not disconnect the patient of the pump so they have minimal downtime. Their BP is not going to drop, it's not going to tank, they're not going to go into cardiac arrest, right? And it allows me to set up my pump, initiate the medication, right? And then when I'm ready to transition, it's a quick, right, turnover, right? I disconnect basically the central line from what I was running, and I set up and I basically connect my drugs to it. So how would you go about doing it? I'm not wearing gloves because I'm using my phone and I need that to be available to show you stuff, but definitely going to use gloves to do this. So what you're going to do is you're going to open your syringe, and we said we're going to be making a label, so I'll show you how to make the label. So it's very easy. You basically put tape on your syringe like so, right? You go put 2 if you like, and then what I usually like to do is I usually carry a Sharpie marker with me, and I use my Sharpie marker to basically write what I need to infuse. So this, what I'm writing here is I'm basically copying the label that's on the hospital, right? So here I'm going to record Norepi, right? It's 8 milligrams in a 250 bag. The concentration always stays the same, right? Even though we're going to pull up 60 mLs, right? That's the volume, but the concentration remains the same. So I know this is my drug, Norepi. And the next thing you're going to do is you're going to take your 18 gauge needle, right? Which is here, right? Be careful not to touch this end with your fingers, right? You will contaminate. So don't touch this end. Connect it like so, your lure lock, right? And then what you're going to need is you're going to need an alcohol swab, right? So if you come to this bag, usually all these bags have a port where you put your administration set, and here's you add. You see it says add. This is for the set, and this is to add, but you could definitely pull your medicine. So I remove this, and then what I'm going to do is I take my alcohol right here, right, and then I swab. Take my syringe, make sure it's in focus, right, and I'm going to essentially penetrate, and then I withdraw. And you see the reason why I told you to use an 18 gauge needle or bigger. See how it's hard for me to pull? If you use a 25 gauge, it would basically be impossible for you to do this. I'm gonna fill this up until I have 60 mLs. Now, as I'm doing this, right, I'm not disconnecting the patient of the pump. They're still getting the medicine. So I overshot a little bit, that's fine. When you disconnect this, just I want to make sure I get all the air bubbles out. I have a garbage bin right here. Right, all the air bubbles is out. And then once all the air bubbles is out, your label is in. Basically, you're gonna close, right, my sharps. This is gonna go into the sharps container. Right, I'm not going to disconnect this just yet. Why? Because what I like to do is, the next thing I like to do is I take my half set, right, and I already explained to you, right, it has no administration, has no drip chamber, right, and it's 6 mLs. So I usually just open it like so. I usually use the bag in order to flush it, and then I don't unravel it, right, I keep it just as is. This is the side that is going to go into the patient. This is the side that we're going to flush, right? So I keep this like so it's flushing here. Disconnect this. You want to be careful that you don't touch again this port, right? Disconnect your needle. This goes in the sharps container, and then you connect your syringe, and then what you're going to do is you're going to flush. You're going to flush, I said 6 mLs. I'm going to actually flush this syringe until it's 50. Make sure it's in focus. So I see it's dripping inside. I'm just going to move it to 50. All right, now we're good. And the next thing that I like to do is I take this cassette and I open it, so there's no free flow, right? So I open the cassette. So now we already set up our pump. This is my no-epi, right? And I'll show you what I'm gonna do next. So on this pump, on the sides, right, you see, right, this housing is for your 60cc syringe. So on both sides, right, you could basically put your 60cc syringe. So I'm gonna put it on this side, just so you guys can see. So this side is unobstructed. What I do is I basically gonna thread, right, my plunger, my syringe here. You wanna make sure that once it's in, nothing is obstructing the movement of the plunger. So what I mean by that is this is connected like so, and this can move freely, right? Adjust your straps so everything is secure, right? So this case is actually made to hold syringes, so don't let anyone tell you otherwise. The next thing, right, this is what we're gonna do. I'm going to go ahead now and I'm going to show you how to insert this cassette into the recess so that you have no alarms, it doesn't beep, it doesn't give you any issues, right? So we already pre-flushed it, so I know there's no air bubbles in it, right? Untangle everything. So what you want to do is as follows, right? We're in channel B, nothing is infusing. So you're gonna put this in a 45-degree angle, and I'm not pushing this in just yet. What I want to do is first, I want this blue tubing at the bottom, I want to put it in the recess, right? And then I'm going to push in the cassette. So tubing goes in first, and once the tubing is nice and snug inside, I'm going to use my fingers to basically push the cassette in like this. If you did it right, you're going to hear that audible double beep. Audible double beep confirms that the cassette has now appropriately been placed, right? The next thing I usually like to do before I connect this to my patient, I always take a tape, and always on this end, right, I put the tape where there is a port, right, like so. I put the tape, right, and again I want to make sure, right, we know exactly what's infusing here, right? So I'm gonna say no repi, right? So I'll label this here. You could label it here, right? So now syringe is in, right? Drug is in, and then what you're gonna do is you're gonna say channel B and you're gonna say start, right? I'm gonna take off this cap, right? So it starts to infuse, right? So the medicine is infusing. Put this in my garbage bin for now, so it's essentially infusing, right? So again, the benefit of this mode, as I said, let's say I'm doing my transport and I know, right, based on this drip sheet and the doctor's orders, right, the doctor has informed me, right, if during transport patient's vitals, right, and hemodynamic status decompensate, that his MAP drops to less than 65 and I want to keep the MAP at 65, my next titration dose is 1 mic up. So I was infusing at 15 mics a minute. The next one I have to go at 16, right? So what are you gonna do? So here we see, right, we're infusing this drug at 15 mics a minute. It's very simple. You just click this up arrow, right, to 16, and then you click enter to confirm, right? And automatically, right, at 16, on this drip sheet, it tells me it's supposed to be 30 mLs an hour, and in fact, right, you see 30 mLs an hour. So the pump does the calculation for you. Now if we were in this primary mode, I'm going to click channel A, right, where we're infusing at 28 mLs an hour to get our 15 mics a minute, and now I had to go up by 1 mic. How would I know to increase it to 30 ml? I would not. I would have no idea, right, because you are infusing this in the incorrect mode, right? So basically what you want to be is employ, right, the dose rate calculator, right? You want to set your dose, you want to set, right, your volume remaining, and then during transport I'm going to be documenting this volume infused and dose infused on my ACR when I arrive to the receiving facility, right? And I do my handoff report. I'm going to show you one more drug, right? I want to show you one more drug. I want to show you dopamine, and I'm not gonna essentially pull this up, but I'm going to show you how to input this on this pump. I have another drip sheet for dopamine, and the reason why I want to do it, I want to show you how to do a weight-based drug as well, right? So dopamine, right? We all know dopamine, right? Again, can be given in cardiogenic shock for vasoconstriction, could be also be as a chronotropic dose rate. So let's say your concentration here is 800 milligrams in a 500 bag, so that will be on the bag itself in the hospital, right? And let's say this patient is getting this medication at 10 mics per kilogram per minute. And for this example, to keep it nice and simple, let's use a 100 kg person. So at 10 mics, right, and a 100 kg person should be receiving 37.5 mLs an hour. So I know if I set up my concentration correctly, 100 kg patient, right, at 10 mics per kilogram per minute should get 37.5. So let's set this up. So as I was showing you, you're going to click channel C, and if this was up here, right, the way you would go to this is more option, right? So it says calc off. We don't want to, we're going to turn this off just to show you, right? So channel C, more options, calc on. So now we are in dose rate calculator, exactly where we want to be. All right, patient's weight. We said the patient's weight is 100 kilograms. So we're going to set this up. Fast arrow. 100 kilograms. It automatically will calculate the pounds for you. You don't have to do anything. The concentration, right? Let's look at the bag. 800 milligrams in a 500 bag. So let's set up our 800 milligrams. So you click up arrow. $800 milligrams, 500 bag. Right, confirmed, right? Looks good. The next thing we gotta look, is it mics per kilogram per minute, right? And this is in fact mics per kilogram per minute. Now, let's say if it wasn't mics per kilogram per minute, right, there was some other units, you just click arrows up to arrive at the appropriate unit. So you see grams, units, right? And then milliequivalents, right, millimoles, and so forth. So we say mics, that's correct. Per kilogram is correct, right? We could move it up and down, but that's correct. And then this is, we could choose day, hours, but it's per minute. So that's everything is correct. And we said this constant, the dose, right? It was 10. And for a 100 kg person, we're supposed to be giving 37.5 mLs an hour. So let's say, let's set this at 10. Right, the moment I set this at 10, I click enter, right, we see 37.5 mLs an hour. And the next thing you do, right, volume remaining, depending, right, if you're using a syringe, right, this may be 50. If they give you a fresh bag, you could put a fresh bag. If you used, a remainder of their bag, you could put the appropriate amount. So this is how you would set this up. And then you insert your cassette, excuse me, flush it as necessary, and then start your infusion. Now, let's say during transport, again, your map starts to decline. Let me take out my sheet, right? So this was a 10 mics. Let's say they tell you to titrate at 5 mics per kilogram per minute every 10 minutes. So let's say if we had to go from 10 to 15, right, to 15 mics. So 15 mics for a 100 kg person, right, should be 56.3. 56.3. So let's see, right? So I go up here to our dose, and I'm going to put 15. And then, in fact, right, the moment I confirm, you see 56.3, right, mLs an hour. Take my drip sheet, right, 100 kg person, right, at 15 mics should be 56.3. So this is how you would do it. Make your titrations as necessary, right, and infuse, right. So definitely employ the syringes. You could put bilateral syringes, you could put another one if you need to. I have a setup showing you, how to do this. One other important thing that I want to show you, and I showed that in my video, right, for administration of the vasopressor. So let's say if you come to the bedside and they just place the central line, right, which ports to employ. So usually I have a central line right here, right? So this is a central line, and you notice, right, I am running my pressor, right? This is, we said this is no epi. I'm running it via central line, right? So this is how it's infusing, right? What you can do is you have an app called Micromatics, and let's say I'm going to show you, right? Let's say we said dopamine and norepi, right? Let's say these are two drugs. So this is the app, right here, IV compatibility at Micromatics. So I open this app up, and what I want to do is I want to see if I can Y-side connect. Y-side connect means I can connect two drugs together, right? So they run in the same lumen of the triple lumen catheter. The first drug I'm going to say I'm going to look is norepi. So this is, and I selected, right? So norepi selected. The next drug I'm going to select was dopamine. Dopamine, right here, and I selected. So when I go to my drug list, right, I'm going to remove this one, right? We said the drug list, we had dopamine and we had norepi. So, and I want to check Y-side compatibility. And here, right at the bottom, right, of this app, it tells you, right, to check for compatibility. So here it tells you the Y-side for dopamine, hydrochloride, and norepi is compatible. You see this check mark, right? And they are, right, they can be used together for Y-side connection. I'll show you what I mean by that. So what Y-side connection is this. So this medication, right here on a triple lumen is being infused, right? This we're gonna say, this we said is the norepi that's infusing, right? So this is the norepi that's infusing. Let's pretend this was our dopamine that we set up. We said it was third channel, but let's just pretend it was norepi. We just confirmed that it's in fact Y-side compatible. So what you're gonna do is, this is already going into the triple lumen. On your administration, right, you're gonna find this is called the Y port connection, right? And you could use the alcohol to cleanse it, but the best thing to use, right, if you can, you have these nice flushes, and on this end we have a swab cap. And usually what I do is I usually keep them closed, right? The swab cap usually stays on like this. Right? But this swab cap right here can be employed, right, in order to cleanse. Remove this from the plastic. So during transport, I usually transport, you know, with these closed, but what you can do is you can use it, right, in order to cleanse your ports, right? So you cleanse your ports, and then what you're gonna do is you're gonna Y-side connect. So you're gonna Y-side connect like this. So we just Y-side connected our pressors. They're usually going to be labeled, right? So label here, right? This is another Y-side if I needed to do a third pressor. This is another, right, pressor that's coming out. So now I have two drugs going. Let's say they were norepi and dopamine. If let's say I had vaso, I had epi, right? Again, you could also connect them to the Y-side and then check this app, right, the Micromatics, for compatibility. Usually what I like to do if I have somebody on the central line, and I usually do that in the hospital as well, my recommendation is this: if you're not transducing and you're not giving blood, I use the distal port that comes out at the very tip here for my pressors, right? So this would be my pressor. So all my pressors like dopamine, my vasopressin, my norepi, my epi are going to be compatible, and they're going to be running through that Y-side. The medial port, right? So, and the distal port is 16 gauge. The proximal, right, and the medial, right, these two ports are 18 gauge, and I have a video on the triple lumen. The blue port, right, the medial port, I'll probably connect all my sedation, my propofol, my fentanyl, right, and this white one will be empty, right, nothing connected to it. I usually have it in where I need to give push dose medications. So let's say patient goes in cardiac arrest and I need to give an epi push, right? I will connect it here, or maybe I need to give IV fluid bolus or anything along those lines. This stays free, right? Another reason why I like to keep it free, in case the patient needs total parenteral nutrition, TPN, we cannot infuse any medication, so you could just keep it open in case the patient doesn't need any emergency medicines. But usually that's my thought process, right? You got right distal 16 gauge, your pressors, right? Medial sedation, and this is our proximal 18 gauge. You're running any push dose medicines that you're going to employ. This is how I would set up my drug. Now the other thing I'll show you, right? So you see on this primary rate we only see volume infused, right? But this drug has already been running, right? The norepi, right? So you see, even though we're infusing at mics per minute, we already infused 0.1 milligrams. So this will be, if they ask me, oh, how much the patient got, I will tell them, right, 0.1 milligrams. And the other very, very important thing to know about these drugs, I have these drip sheets, right? And you want to be very much familiar, right? What's the min dose, what's the max dose between these pressors and sedation. Why? Because if you show up to a hospital and somebody is on 30 mics a minute of norepi, right? And then you look, oh, they also got dopamine, and dopamine is infusing, right? You know, like max dose is here, right? I could max dose here at 50 mics per minute. You know, the patient's probably not doing so good, right? So they're maxed out, and if their blood pressure's in the toilet, they have poor maps. Be very careful. Those patients in the hospital, I don't even turn, because if you turn, they may go into cardiac arrest. So be very gentle with handling them, right? And make sure, right, you do not disconnect the patients off the pump for a prolonged period of time in order to flush your medicines. So this is how I would set up my pump.